This is the Emergency Medical Minute, sponsored by Health One.
Okay, I'm going to read you a couple of quotes from your favorite nurses. I asked for the procedure timeout. Dr. Miller said, thank you. Dr. Miller said, look, we're all on the same page here. Let's get going without all this timeout nonsense. Here's another quote. The patient was hypotensive and we started vasopressors. I told Dr. Bakes as soon as I started the infusion. Dr. Bakes yelled at me for 5 minutes about not giving the necessary information. Okay, those aren't really quotes from our doctors or from our nurses. Those are from an awesome paper called The Association of Coworker Reports About Unprofessional Behavior by Surgeons with Surgical Complications in Their Patients. So basically, there's some investigators who wanted to find out, if you're a mean surgeon, does that mean your patients have more complications? So over a 4-year study period at 2 hospital systems, they had a database by which nurses... Yes, you can join in the Medical Minute. Nurses and other staff members could enter complaints about the unprofessional behavior of surgeons, similar to the quotes that I just read to you. And they divided those unprofessional behaviors into 4 categories: poor or unsafe care, respect and communication, integrity, or responsibility. So over this time period, there were 13,000 patients that underwent operations. And how do you think the results turned out? Any guesses? If you're a mean surgeon, does that make you a better surgeon or a worse surgeon?
Worse.
Worse. Okay. You think they're the same. All right. So here were the results. So if you were a surgeon that had 0 complaints about your care, your complication rate was about 10%, 10.7%. If you were a surgeon with 4 or more complaints, your complication rate was 14%. And they tried to adjust. That doesn't sound like much, but it is statistically significant. They tried to adjust for a bunch of variables to make sure all the patients were equal, so that it wasn't like the mean surgeons got the sick patients. And after they did all their complicated statistical analyses, the results held that it was statistically significant. If you had a surgeon with 1 to 3 complaints, interestingly, that was like the highest risk category, rather than greater than 4 complaints. So if you had 1 to 3 complaints, there was a 14% higher risk of your patients to have complications. And if you had 1 to 3, sorry, that was 1 to 3. If you had more than 4, it was an 11.9% risk of complication. So the take-home message is being nice is not only the right thing to do, but it provides better care for our patients, and they're less likely to have any complications. And that's the end of the story. That's it. Thanks.
Thank you, Mr. Harry.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.